Hello, everyone, and thank you for joining us today for a Learning and Growing webinar on supporting college students on the autism spectrum. Our presenter today is Professor Jerrod Brown of Concordia University, St. Paul, Minnesota. My name is Sidra, and I'll be your moderator for today for Hawks Learning. We will have a live Q&A session after the presentation, so please enter any questions you have into the Q&A module as we go, and we'll be sure to answer them at the end. I'll now hand it over to our presenter.
Well, great. Thank you so much. And good afternoon, everyone. Thank you very much for signing up for today's webinar presentation. Again, my name's Jerrod Brown, and we're going to talk about the topic of autism and really what college professors need to know and working with students on this spectrum. So if you have any questions, again, type them in the chat box. If you have any questions you think of after the fact, my email address is listed on this particular slide. Reach out anytime. I have tons and tons of resources on really all things autism. Here's a copy of today's training description I believe all of you have. And this is a copy of my brief professional biography. I'll just spend just a moment on this, but I am a professor, trainer, researcher, and consultant. I've done numerous trainings for different groups nationally, locally on the topic of autism. I have 2 certifications in autism, a graduate certificate in autism. I provide lots of consultation to different groups on this topic. So we'll definitely take a deep dive into really all things autism today. We're going to cover a lot of information in a very short amount of time. So you're going to be on information overload. But I encourage you to go back and listen to today's webinar presentation. I believe it's going to be recorded, so definitely go back and listen to it again if you can. So when we think about autism, we all know that it's a neurodevelopmental disorder. It begins early on in childhood. It is the fastest growing neurodevelopmental disorder in the United States. So currently, the most up-to-date statistic is, I believe, around 1 in 44. If you look at those statistics going back a few decades, that number has grown astronomically over the past 20 or 30 years. This is a true spectrum disorder. You will work with individuals probably that might be a lower functioning, sometimes higher functioning, and they can fall anywhere in the middle in terms of functioning. The symptoms can vary from person to person, but the core deficits of autism are going to be social communication and repetitive and restricted kinds of interest and patterns of behavior. We'll talk about all of that today as well. It's very important to know that individuals on the autism spectrum will have different talents, different skills, different qualities, different attributes, but they will also have different limitations, different deficits we need to take into account as well. Most people with autism are going to probably be dealing with some level of anxiety. Sleep issues are very common, digestive health issues. A lot of times individuals on this spectrum will also be dealing with sensory processing deficits. I'll talk about that today as well, but if a student is in a classroom who has sensory processing issues, bright lights can overwhelm the individual, cologne, perfume, lots of clutter, all of these things can overwhelm that student's senses, and sometimes they can shut down, sometimes they really become more irritable. So it's very important to understand sensory processing issues as well. But we'll cover all of that in great detail today. At the bottom of my slides are my full citations. If any of you want a copy of these slides, just shoot me an email. I'll be more than happy to share that with you. So one of the core deficits of autism is going to be these restrictive and repetitive patterns of behavior. This could be like repetitive types of movements. It could be very restricted kinds of interest. Typically, folks on the autism spectrum struggle with change. So broken routines can be really tricky for some individuals. Some of these individuals will have ritualized patterns where they may have like a pattern of behavior where they want to sit in the same place every day. They may want to eat the same food every day. It is not uncommon to have these kind of consistent patterns of behavior. It is also something you need to be aware of that in highly restricted environments, in some cases, the individual can present pretty competently, in my experience. But if the individual is not used to being in an environment where there's a lot of change, a lot of things that are just people are coming and going, this can really overwhelm the individual. Uncertainty can be a huge stressor for this population. Confusion is a huge stressor as well. So we really want to be aware of that. Routine, structure, consistency, and predictability are really recommended as best practices in working with this population. Obviously, that is not always possible depending on the setting that you work in. It is very common as well for individuals on the autism spectrum to be dealing with some level of obsessional kinds of behavior or compulsive kinds of behavior. Some of the things you'd want to take into account when we look at this through a lens of compulsive types of behavior, maybe the individual performs a particular action or behavior over and over and over again. It could involve repetitive thoughts or urges. It could be very distracting to other people around the individual. It could be alarming in some cases to people who don't understand autism. In some cases, the person, it could look like really obsessive compulsive kinds of traits where they might be checking things over and over again. In some cases, someone on the autism spectrum may count things repetitively as well. These are very normal. Sometimes, again, it could be alarming to onlookers who don't understand the individual on the spectrum. So I commend all of you for taking time out of it today to really try to understand a lot of these deficits and behavioral patterns that these individuals deal with in some cases. And if we can better understand them, we're going to be in a much better position to support them in an academic environment much more effectively. So this is sensory processing. I mentioned that before. This could contribute to unexplained behaviors in some cases for the individual on the spectrum. This could contribute to more mood problems. So people who become overloaded as a result of sensory processing issues, it can have a really negative impact on their mood, their energy. They may become under-responsive in the classroom. They may become over responsive where they're moving a lot and they're distracting other people. Some people with sensory processing issues may only wear certain kinds of clothing. They may refuse to eat certain kinds of food. Again, they could be very sensitive to light, certain kinds of smell. They may lack body awareness where they don't realize that they're talking too closely to someone. In some cases, someone with sensory processing issues may also struggle with going up and down stairs, bouncing a basketball, catching a baseball, riding a bicycle. These are all things just to be aware of through this sensory processing lens. Most people with autism are going to be dealing with some level of executive function impairments. Executive function is the boss of the brain. This is the CEO of the brain. This relates to decision making, problem solving, reasoning. Later this year, I'll be doing a training just on executive functioning impairments for Hawkes learning and what you need to know when working with students in a classroom setting with this. So be on the lookout for that. Executive function plays a very critical role in goal planning and goal setting, as well as academic performance. Adaptive functioning, which is also on this slide, relates to the way we carry ourselves in day-to-day life. So independent living skills, social responsibility, how we manage money, do we use time effectively? How do we interact with people in a social arena? These are all adaptive skills. And what the research shows, people on the autism spectrum frequently deal with executive function impairments as well as adaptive functioning limitations. This can get in the way of homework completion. Time management issues can be quite common. In some cases, this could contribute to more disorganization where the person is just more forgetful. They just seem very disorganized in their behavior and their thinking patterns. Some other things that you want to be aware of when we're studying the topic of autism. First one here, I have abstract reasoning underlined. If you believe what the research says, abstract reasoning is kind of the ultimate higher order cognitive process human beings have. Abstract reasoning relates to connecting the dots, planning for the future, quickly identifying like patterns of behavior. It really plays a critical role in reasoning and solving problems. So just think of it as a deeper way of thinking. People on the autism spectrum oftentimes struggle with abstract reasoning. They do much better when things are very concrete and laid out very explicitly to the individual. I have weak central coherence underlined as well. Basically, what that is think of it as tunnel vision. When somebody has weak central coherence, they oftentimes have a very difficult time seeing the forest through the trees. They get really focused on like an object or a person or a situation. They have a hard time shifting their attention from one kind of variable. They have a very difficult time, again, seeing what's going on around them. That's a core deficit in people with autism. And then behavioral rigidity is also underlined here. Basically, this is a component of executive function. And if you're ever working with a student who has behavioral rigidity, they could come off as looking like they're very stubborn. Sometimes it could look like they're coming off as very cold or callous. And it could present that that person is just very one-sided. I caution you to jump to conclusions thinking that person's doing it intentionally. A lot of times it's more rooted in the deficits associated with autism. If someone has behavioral rigidity, they have a very difficult time in shifting their attention from topic to topic and engaging in flexible thinking and behavior. Everyone with autism will have social cognition deficits. Social cognition is really the umbrella term of how we do in the social arena. This really relates to how we get along with people, understanding social rules, social cues. There are elements of empathy that fall under this umbrella. This has a lot to do with perspective taking, give and take relationships, how someone works in a group setting, how someone gets along with people one-on-one. People with social cognition deficits a lot of times struggle with maintaining friends in some cases. They can really struggle working in a group setting. And this can also get in the way of that person finding employment and maintaining long-term employment as well. So social cognition deficits, another big topic to be aware of. Under the umbrella of social cognition is something called theory of mind. This relates to perspective taking. This relates to the person's ability to understand internal mental states of other people. So really think of it as that person's lack of ability to understand the thoughts, the wants, the needs, the emotions, intentions of other people. This can really get in the way of give and take relationships. This sometimes can look like the person has empathy deficits. This is also a very core deficit among people on the autism spectrum. Most people with autism will be dealing with a co-occurring mental health and or physical health issue. Some of the most common co-occurring issues you're going to find in this population are language-based disorders, attention deficit hyperactivity disorder, higher levels of epilepsy have been noted among people with autism, higher levels of intellectual and developmental disabilities, but it's important to keep in mind that still the majority of people with autism don't necessarily meet diagnostic criteria for having an actual intellectual or developmental disability. Most people with autism will probably be dealing with some level of anxiety or depression at some point in their life, the research says. Most people with autism have sleep issues. Most people with autism also have digestive health issues. Keep that in the back of your mind, why it's important to truly understand digestive health issues and sleep issues when we're talking about learning and education. I'll talk about that in a few minutes. One of the most common co-occurring issues among people with autism is going to be attention deficit hyperactivity disorder. People with ADHD can have like inattentiveness. Impulse control problems obviously are at the core of this disorder. Hyperactivity issues. Untreated ADHD has been linked to having lower grades, more problems with drug and alcohol issues, coming into contact with the criminal justice system. The list goes on and on and on. Another thing you want to be aware of in the classroom setting is the fact that a lot of people with autism may also be dealing with higher levels of social anxiety. And if you have a classroom and you're requiring students to give presentations, I'm not against presentations at all, but just be aware that that could be a huge trauma trigger for some people on the autism spectrum. So just take that into account. Are there ways to make modifications to that? The reason why a lot of people on the autism spectrum have social anxiety is because, unfortunately, a high percentage of these individuals have experienced a lot of bullying, teasing, trauma, rejection at various points in their life. I've consulted on numerous cases where there's been bullying and teasing at play. I've consulted on a case, I think it was last year, where the person actually dealt with some bullying and teasing in college. I've consulted on numerous cases where the individual has dealt with some online victimization and cyber kinds of bullying as well. So keep that in mind if you look through a lens of social anxiety. Unfortunately, too, it's very, very common for folks with autism to have more emotional dysregulation. Higher levels of irritability have been noted, lower levels of ability to manage stress and change and adversity and uncertainty. This can absolutely trigger full-blown kind of up and down mood swings in some cases. I've seen it play out many ways. Sometimes the person may just shut down and it looks like they're falling asleep. Other times the person may become so dysregulated, they just storm out of the classroom. So you can see it in many, many ways. When we think of people on the autism spectrum, when we think of these co-occurring issues that I'm pointing out, if the individual is dealing with like anxiety, depression, social anxiety, these are internalizing symptoms. These are symptoms that the client experiences inwardly. So it's more difficult in some cases to detect these. On the flip side of this, it is not uncommon for this population to also be dealing with externalizing behavioral problems in some cases. These are things that we can see a lot easier. This could be more disruptive behavioral patterns. So we want to be aware of internalizing problems as well as externalizing problems. So I mentioned before about language. If you work with people on the autism spectrum, take into account that a good percentage of these individuals may be dealing with some level of language-based impairments. Not all individuals on the spectrum will have this, but a lot will. So we need to be aware of receptive language. That's basically how that person takes in the language you use in your classroom, maybe during a lecture. So sometimes people with autism have a hard time taking in that information and processing it and making sense of it. Expressive language relates to how that person uses language to communicate with you or other people, just basically how they articulate things and share it with the outside world. Another component of language is called pragmatic language. This is very common among people on the autism spectrum. When you study pragmatic language, just think of this as language in the social arena. How do we use language to greet people? to start a conversation, to end a conversation? How do we use nonverbal cues like eye contact, facial expressions, body gestures? People with autism typically have deficits in the area of social language skills, which is pragmatic language abilities. Problem-solving deficits have also been noted among many people with autism. Why might this be the case? Because remember before we spoke about executive function briefly. People with executive function impairments typically have some level of deficits in the area of problem solving and decision making. So this is another variable to take into account. If you notice that the person is struggling in the classroom, really dig deeper. Maybe the person might need some modifications to the way in which they take notes, how they make sense of the requirements of the classroom. If you can make the modifications, the individual can absolutely be much more successful. This is another huge topic to be aware of. Basically, think of this as if someone has mental processing speed weaknesses, their brain can't take in a lot of information in a short amount of time. So it becomes almost like a traffic jam in their brain. So if the person with autism is sitting in the classroom and there's a lot of information being presented to that individual, maybe there's a lot of background noise, there's a lot going on in the classroom, a lot of side chatter, all of that information can overwhelm the person's brain. And it really is like a bottleneck or a traffic jam in their brain. They really can't take in any more information. So this is another reason why some people with autism may struggle in a classroom setting if we don't make some modifications. And this is one big reason why. Half of people on the autism spectrum, according to the research, have alexithymia. This topic is a huge topic to be aware of. It's not just an important topic to be aware of in the autism world, but if you're working with students with any kind of disabilities. Alexithymia is basically emotional blindness. Someone with alexithymia has a hard time identifying, naming, labeling, and recognizing and communicating and expressing emotions with other people. So it's a breakdown in emotional communication. So if you're ever doing like a group project and someone has alexithymia, in that group, in some cases, they could show little to no emotion. They might show a flat affect. There could be a breakdown with other group members because sometimes group members may misread that individual's facial cues as that they're not paying attention, they're frustrated, they're angry. They could be dealing with alexithymia, which is a breakdown in emotional communication. In some cases, some people with autism may also be dealing with something called sluggish cognitive tempo. In the classroom, this could look like the student is really checked out. They're just very spacey. They're daydreaming. They're apathetic. They just seem very unmotivated. So if you have a student where that kind of fits that profile and they just seem very drowsy all the time and they're just absent-minded and they just move really slow, try not to jump to the conclusion that that person is lazy and just doesn't want to be there. Could there be something going on with their brain that is causing this? In some cases, maybe. This is called sluggish cognitive tempo. Really important topic to be aware of as well. So folks with autism, more times than not, will probably have some level of impairment in the area of nonverbal communication. I've seen this in a lot of cases I consult on. Sometimes there's unusual eye contact. Sometimes the person stares for a long period of time and doesn't look away. Other times the person may never make any eye contact. They may, again, walk very close to someone, or they may walk very far away. They could come off as very socially awkward in some cases or emotionally flat in others. Everyone with autism presents differently, but the research does point to the fact that a high percentage of folks with autism will be dealing with some level of non-verbal communication deficits. Unfortunately, the research is also very clear on this, that people with autism oftentimes face a number of health-related disparities, disabilities, and impairments. Some of the most common ones that are found in this literature relate to increases in depression, hypertension, sleep issues, and gut issues, as I mentioned before. Unusual eating patterns have been noted in many people with autism as well, where they might have really selective eating patterns. Quite a bit of research talks about nutritional deficiencies in this population. Unfortunately, too, there's many studies that have been published on autism and obesity. In some cases, the person may be dealing with some obesity related problems. In other situations, I've consulted on many cases where the person's been in a group home where they're not in a college setting and they live a sedentary lifestyle. All of these things are talked about in this research literature. So we know sleep problems are very common among students in general, and these numbers are even higher now because of COVID and all the stress and the aftermath of that. But just know that when you're working with folks with autism, the rates of sleep issues among this population is significantly higher than the general population. Obviously, insomnia is going to be the most common sleep issue in this population, but it is not uncommon for this population to also be dealing with other kinds of sleep-related impairments. From an academic perspective, if you're working with students who are sleep impaired, regardless of their disorder, that can absolutely be a major threat to that person's memory and their learning capabilities and how they can stay focused. And it can also negatively impact their mood and their motivation. So sleep issues is a big topic to be aware of as well. And when we're talking about sleep, it is imperative to understand circadian rhythm misalignment. There's plenty of research that talks about circadian rhythm misalignment is very common among people who work shift jobs as well. So maybe you're working with students without autism and they're dealing with this because they work the overnight shift. Circadian rhythm misalignment can happen from so many things, but this is a disruption in their natural sleep cycle. And then the next day when they go to class, if they're dealing with this, they could be really drowsy and just checked out. They forget things. So this is a big threat to that person's ability to be successful in the classroom. So I mentioned nutrition before. If any of you are working in like college nutrition programs, this is just something to be aware of. Lots of research talks about nutritional deficiencies, picky eating patterns among people on the autism spectrum. I do a lot of work in the area of the gut-brain health axis, microbiota, gut dysbiosis. Why in the world should you care about this if you're a college professor about digestive health issues? The reason is if the person is dealing with digestive health issues, they are absolutely dealing with brain-based problems as well, and vice versa. It's called the gut-brain health axis. If the gut is off, the brain is off. If the brain is off, the gut is off. It has that bi-directional communication. Most of our immunity is in our gut. Most of our serotonin is produced in our gut. Gut health issues are very common in the general population and can come from all kinds of things: stress, trauma, adversity, hardship, drug and alcohol problems. But if you look at the research on autism and digestive health issues, as many as 90% or more of people on this spectrum deal with digestive health issues. Most of the cases I've consulted on, the person on the autism spectrum deals with digestive health issues. So if someone has digestive health issues, that can trigger more anxiety, more depression, more sleep issues. The list goes on and on and on. If you're a college professor, you would do well learning about the gut-brain health axis. Unfortunately, again, bullying victimization is very common in this population. Trauma histories are very common. So it is very important, if you're a teacher, maybe utilizing some trauma-informed teaching practices. That can go a long way. And especially just think about what all of us have gone through the last several years with COVID. So many students right now, regardless if they have autism or not, are dealing with a lot of challenges, a lot of worry, a lot of fear, a lot of uncertainty. If you utilize some trauma-informed teaching approaches, that can be very, very helpful. Another just deficit for us to be aware of is the fact that a lot of people on the autism spectrum may be dealing with higher levels of gullibility. So this can contribute to that person being taken advantage of or being easily fooled or cheated. This can absolutely contribute to more victimization and trauma for that individual. And when we talk about gullibility, we also need to be aware that many people, unfortunately, on this spectrum deal with some level of social naivete. This relates to lacking judgment or wisdom. I see this play out a lot on some of the cases I've consulted on where the individual seems to have like a screen time addiction, where they give money away to strangers in some cases. They're not picking up the fact that people are trying to take advantage of them. So these are just some things for us to be aware of. College professors, too, this is an important reminder that in some cases, students with autism may not always function at their chronological age. So let's say you're working with a student who's 20 years old chronologically. If they're dealing with delayed social maturity, they may be functioning as a 15-year-old, a 16-year-old, an 18-year-old. So be aware that delayed social maturity doesn't always match up with their chronological age. And unfortunately, too, the risk of suicidal thinking among people with autism is way higher than the general population. So it's very important for school counselors, psychologists, social workers to be aware of this, and also college professors just to be aware of some of the risk factors and warning signs around this, because the research really points to the fact that people on the spectrum may have higher incidence of thinking about suicide than the general population. So that's a foundation there. That was 40 hours of content in about 30 minutes. Again, please go back and listen to this to really absorb it. If anyone has any thoughts, questions, and concerns, just type them in the chat box. From an educational standpoint, again, think about all the things we just spoke about. If the person is dealing with a lot of those deficits, limitations, or barriers, that can really get in the way of that person being successful in college if the college program or the professor doesn't understand autism. College is a wonderful thing. It promotes cognitive development, critical thinking. It helps the student develop increased locus of control, increases in self-efficacy, greater levels of personal responsibility, and the list goes on and on and on. So helping students be successful in college is helping them in so many areas of life. Shockingly, there's a lot of articles and studies that have looked at the topic of autism within the context of going to college. And what the research has shown, and it can differ from study to study and person to person, but collectively, this research has shown that people on the autism spectrum may be less prepared to go to college compared to other individuals that are not on the spectrum. Part of the reason for that is those executive function impairments I spoke about before. The pragmatic language deficits are often talked about as a potential barrier, and the social skill deficits as well that really can get in the way of that person being successful in college. Through that executive function lens, again, this can impact test taking abilities, taking notes, retaining information from class to class. So we really want to take into account when you're teaching or developing curriculum, really for anyone, is looking at it through an executive function lens. Again, later this year for Hawks Learning, I will be doing a training just on executive function and what college professors need to know. So I will definitely provide a lot of information about that during that time. Again, executive function impairments in the classroom could contribute to more planning and organizational deficits. And in some cases, the student could become more overwhelmed in the classroom setting as well. Other things we want to take into account when we look at this through an executive function lens is the topic of procrastination. Executive function impairments are at the core of academic procrastination. That will be another training I'll be doing later this year for Hawks Learning, is just on the topic of academic procrastination. So if you're working with any student who seems to have a long-standing pattern of procrastination, the evidence really points to the fact that that probably is an executive functioning impairment on some level. Academic procrastination has been linked to students withdrawing from courses more frequently, higher levels of depression and anxiety, greater levels of worry and stress. It's been linked to having more performance anxiety, and it can absolutely get in the way of just overall motivation. Other things we want to be aware of too is the fact that you go to college, you're involved in lots of social activities. For some people on the autism spectrum, being in a group can be really stressful. The social anxiety piece we spoke about before. So maybe they're doing some work study and they have to work in a group. That could be really, really triggering for some individuals. Having to give a presentation in front of lots of people can be very challenging for all of us. I get nervous doing it all the time. For someone with autism who has social anxiety, it could be very, very traumatic. So we need to be aware of how the social arena factors into this and really support the student. Through this abstract reasoning lens, we spoke about this before, this is connecting the dots, planning for the future. These kind of things are very, very important to be aware of. If the student has abstract reasoning deficits and you're asking that student a bunch of how and why questions, that could be very tricky for someone with these kind of deficits. How and why questions are oftentimes very difficult to answer when someone is dealing with abstract reasoning deficits. Other things you'd want to take into account, the list goes on and on and on. So within the college environment, what do we want to be aware of? Difficulties with social skills, top of the list, want to be aware of. We want to be aware of organization and time management difficulties. So maybe there's some coaching or some extra support around that area. That could be very helpful. We want to, again, take into account the sensory component. We talked about that before. For some students on the autism spectrum, being in that classroom where there's a lot going on and a lot of clutter and bright lights, that could overwhelm the senses for the individual, and it could be a potential barrier for that student not being as successful as possible. Remember, difficulty coping with change can be very, very tricky for students with autism. And public speaking and working in groups could be tricky. So we want to be aware of all of these things. I'm not saying not do those things, but take it into account, work with the student, maybe provide some modifications, these kind of things as well. We want to be aware of the topic of academic self-regulation. We know from the research that people with autism, particularly people with autism that haven't had a lot of supports and services in place in their life, are going to be probably dealing with some level of self-regulation problems. Self-regulation is a big topic. I give tons of talks on the topic of self-regulation. This is a very important topic for college professors to be aware of because self-regulation issues can impact student behavior in the classroom. It can impact their memory. It can impact their planning abilities. It can impact that student's ability to recognize and name and label their own emotions. So self-regulation deficits can get in the way of academic learning. Unfortunately, too, some of the barriers that are talked about in the college literature as it pertains to autism is social stigma. There's a lot of stigma still around autism. So people, the more they can learn about this topic and become informed, we're in a much better position to support that individual and see great success as well for that college student on the autism spectrum. In the classroom, remember we spoke about information processing speed before. That's the traffic jam in the brain. Part of this is going to be auditory processing problems. So maybe the person has some sensitivity related to auditory processing. So they might be very sensitive to certain sounds, a clock, an alarm going off, a buzzer, someone's cell phone going off. These could be potential major stressors for someone on the autism spectrum. What the research recommends is obviously being aware of external noise, understanding that student, maybe having a discussion with the student, finding out what are their stressors around noise, loud games, and a movie playing loudly, going to a football game. These can all be triggering events for some people with autism who have these auditory processing weaknesses. The autism literature indicates between 38 and 73% of people on this spectrum may have some reading comprehension deficits. So if the school has an opportunity to do any testing around this or really finding out what is that student's reading comprehension abilities like, that would be very helpful if appropriate for your college setting. Because if you know this, then you can make some modifications to what you're doing to help that student become more successful. If you're asking the student with autism to multitask, that can be very stressful and overwhelming. I would highly recommend, if possible, not to engage in any kind of multitasking behaviors with someone on the autism spectrum, because multitasking can overwhelm the individual, which then can trickle down into contributing to more memory problems. It can increase distractibility, so it looks like the person is not paying attention. It can absolutely impact that person's performance and contribute to higher levels of stress. So try to avoid any kind of multitasking. This is a topic that comes up a lot in a lot of the cases I've consulted on over the years, is humor deficits. It is not uncommon for some individuals on the autism spectrum to struggle with humor appreciation or using humor effectively or understanding humor of others. If you study humor deficits, it talks a lot about language abilities. It talks a lot about theory of mind. We spoke about that before, perspective taking. It also has a lot to do with self-awareness, memory, and abstract reasoning. So if you're in a college setting and a student on the autism spectrum seems to not understand humor or uses it inappropriately, that is not uncommon. So just take that into account during any kind of lecture you're giving or any kind of activity you're running in your college setting. Now, when we talk about college, it's very important too to have a brief discussion about employment after college or during college. Unfortunately, a number of people on this spectrum too may have some difficulty, depending on where they fall under this umbrella, with maintaining gainful employment. I've consulted on many cases where employment related issues has absolutely been a factor. Everything we spoke about before as it pertains to the college classroom really applies to the employment setting. So if you're in a college arena and you are like a job coach or teaching these skills or trying to help students find gainful employment, and that student has autism, just really be aware of all these deficits that I spoke about and really helping support that individual, finding the right employer. I think a key is finding an employer who understands and appreciates autism. If you Google the term neurodiversity, that would be a term I would recommend understanding as it pertains to kind of the environment of setting up an employment environment that would be maybe be more conducive to someone who has a neurodevelopmental disorder. Part of this too, we need to be aware of then if someone is having deficits in the area of maintaining a job or keeping a job, all of those things, this could impact their financial abilities as they get older. So we need to be aware how this can trickle down and impact the individual on all arenas of their life. A big barrier with the employment arena are going to be those communication challenges. So anything you can do in that college arena to support and enhance communication, it's only going to help them be more successful when they move into a job environment. The same is true with the social deficits that we spoke about as well. So taking into account those social and communication deficits, how they can be big barriers in employment and educational settings. I'll stop there just for a second, see if we have any questions I can answer now before I move into the last section in terms of just some tips, strategies, and solutions.
We do have one. Sometimes in class discussions, they struggle with supporting students with autism while maintaining their privacy if they choose to not self-disclose their autism to the class, and also protecting other students who may not understand what is going on and just feel that their social boundaries aren't being respected. Some things can be handled in one-on-one meetings, but they would love suggestions on that you might have for classroom management around that.
Yeah, I wonder if just having a routine lecture on some of these topics, not calling out any particular student, but just incorporating that into what you're doing, just providing some general education about autism, because the research is pretty clear. There are more and more students with autism who are going to college, and there's a high likelihood that most college classrooms has a student in there at this point on the autism spectrum. So maybe all colleges, if appropriate, would do quite well having some general education for staff, for faculty, for students about this. Just the very nature of becoming self-aware, like all of you are doing today, can help us have more understanding, empathy, and we can be in a much better position to support that student. But I do like the idea of some one-on-one talks with the student, maybe referring the student to the school counselor, and even maybe if there's a support group on campus with other students who have autism. Those are some things that might be helpful. And we have a lot of people in the audience today. If any of your colleges are doing any kinds of programs around this, type them in the chat box if you feel comfortable. Share what all of you are doing, and we can all learn from each other as well. So great question. Thank you for that. I appreciate it.
No problem.
So when we think of autism, again, we really want to capitalize on the strengths. Everyone with autism has wonderful strengths and talents and abilities. We want to be aware of the limitations and needs, of course, but we don't always want to focus on that. We want to help build that person up. We want to use strengths-based approaches. We want to use hopeful language, anything we can do to empower that student, using empathy, promoting gratitude, promoting optimism, are typically linked to improved academic outcomes. General skills that are talked about in this research literature, this is appropriate for kids or adults. Maybe you're in a program and it's appropriate to have a social skills class. These are just different things to be aware of. Teaching social skills, teaching turn taking, teaching the use of language in social situations, how to have an appropriate conversation with another adult. How do you talk to an adult different than a child? How do you talk to a stranger differently than someone you know well? These are all good skills to teach. These are some problematic areas you'd want to be on the lookout for and just keep in the back of your mind when you're managing a classroom or whatever you're doing on the college campus. In some cases, the individual can really struggle using what was learned in one setting and apply it to the other. And they can have a very difficult time understanding rules if they're not clear. And part of that reason is those abstract reasoning deficits. Supports and services can be provided, not just face-to-face, but there are plenty of studies that show that students on the autism spectrum may also do well meeting with like a coach or a mentor or a counselor remotely through the computer or by phone. So maybe you're in a college setting and there's not a lot of resources there on campus for a student with autism. Helping them to get connected to some supports and services online is also highly supported as well. So again, the more you can understand executive function, regardless if it's a student with autism or not, you're going to be in a much better position. Executive function plays a critical role in goal planning, intervention, any kind of curriculum development. Take this into account. These are just a few things that fall under the umbrella of goal planning, and all of these are related to executive function. Adaptive functioning, I mentioned before, this is related more to independent living skills, social responsibility. These are general recommendations you can find in this literature too, where if you're a counselor, a school counselor listening to this, it might be more helpful to utilize these approaches rather than deep insight-based therapeutic approaches. The more you can use coaching, modeling, teaching, role-playing, that seems to be more effective for individuals on the spectrum. If you notice someone has self-regulation issues, these are just a few things you'd want to take into account in the back of your mind when utilizing self-regulated learning approaches. This TIC is trauma-informed care, so I don't think you can go wrong as an academic professional to get some training in trauma-informed care. This is a case I consulted on a few years ago. The problem areas are on the left. These are just some of the coping skills the individual found helpful. This person also did quite well with drawing. They really like to draw. They like journaling. So just find out if you're working in an academic setting, again, maybe there's some coping skills you can help that person tap into that maybe can really help them address some of those problem areas a lot more effectively. Exercise has been shown to be very helpful for people on the spectrum, including anybody, of course, but several studies show that just the very nature of people with autism getting out and moving more, walking and exercising, this can help reduce some of those symptoms that I spoke about before. These are some of the benefits associated with exercise. Exercise is absolutely linked to improved brain functioning, which then can trickle down into having better academic performance and sleeping better as well. Maybe your school does some yoga classes. There's actually several studies that talk about the use of yoga as a way to help people on the autism spectrum manage their stress and reduce their anxiety more effectively as well. I've had 2 in-depth trainings on Lego therapy. This is a really fascinating topic. Both trainings came out of the United Kingdom. This was more geared toward kids, but I don't think there's any reason why you couldn't use it for adults. Lego therapy has been used with people on the autism spectrum to help them learn improved communication, conflict resolution. It's been shown to help improve team building. If you're interested in Lego therapy, shoot me an email. I can send you some resources. Or if you just go online, there's all kinds of resources about Lego therapy. I've worked with a lot of adult clients on the spectrum. They love Legos. I love Legos. I think they're cool and stuff, but using Legos to help teach skills has been shown to be very helpful for this population. I do a lot of work in the area of internet addiction, screen time exposure. Most of the cases I consult on now, the individual on the autism spectrum seems to have a problematic relationship with being on the screen for long periods of time. We want to be aware that excessive screen time exposure among students is a true threat to their emotional, physical, and behavioral health. So anytime we can help people reduce their screen time exposure, especially at night, right before they're going to bed, can be very helpful. This is another case I consulted on. Someone was on the autism spectrum and they really struggled with motivation and procrastination. These were just a few strategies this person found helpful that help them increase their motivation. A lot of these are common sense, but I just wanted to lay it out here visually for all of you. Regardless of the student too, building resilience is very important. It's also talked a lot about in the autism literature. Building resilience helps people bounce back from stress, trauma, adversity, and hardship much more effectively. These are just a few things on this slide that can help people build up their resilience. And theory of mind, we spoke about that before, the perspective taking deficits. These are things that can help build greater theory of mind in people. Art-based approaches and using journaling and music can be very helpful as well. Another case I consulted on, the person had just extreme deficits in the area of poor time management. If you notice a student that has poor time management, that is likely an executive function impairment on some level. For some people with time management issues, these are some things that can happen. So making time more concrete and visual, writing things down, using a planner, these can be very, very helpful for people with time management issues. These are a few questions you would want to consider if you're ever working with a student who has time management issues. Time management's a big, big topic. So for some people with time management issues, they may not know what a day truly feels like, or a week or a month. Breaking that down can be very helpful. And if you can help people overcome the challenges and barriers related to time, they're likely going to be much more successful in college. Some other helpful approaches, just common sense things, but these are things that I've promoted in many of the consultations I've done with different groups over the years. But individualize your approach, because every student, again, is different strengths, different needs. Coming in with a non-judgmental lens is very important. So uplifting that person, motivation, empowerment, empathy, kindness, you can't go wrong. And coming off as very positive and hopeful as well can be very helpful. And just being aware too that anytime we can promote healthy living practices in the students we work with as well, typically their brains work better, their bodies work better, and they do better in school. These are just basic things, 101 things to consider when we're looking at it through a healthy lifestyle lens. And last but not least, before we wrap up and answer some questions today, is anytime we can enhance protective factors in the students we work with as well. These are just a few things we'd want to consider that maybe some students might do well with getting connected to some outside resources. So as a ton of information I threw at you today, I'll stick around as long as you'd like to answer any questions. Again, don't hesitate, reach out to me by email. I do lots of talks on the topic, podcasts, I write articles. I'll be more than happy to share any of those resources with you. So thank you, everyone.
Okay, so we have a couple questions. There's a teacher here who teaches criminal justice, which often has highly sensitive topics. Some of these students will say insensitive or off-topic statements at inappropriate moments, and this can be challenging with topics like homicide and rape. Any suggestions on how to manage this?
Yeah, I've dealt with that too. I would say my main area of expertise is the forensic aspects of autism. So I'm definitely well aware of criminal justice, forensic psychological topics. When that comes, well, before that comes up, I think it's very, very important to have clear ground rules in the classroom, not just verbalizing it and discussing what the ground rules are around some of these heavy duty topics, but it might be helpful to also give handouts that go along with what you said verbally, because for some people on the autism spectrum, if they're only hearing it verbally, remember, they might have some auditory processing or information processing deficits. So they may not catch everything you're saying. So verbalize it, but then give handouts. And then in some cases, depending on the individual, some one-on-one coaching might be helpful. Depending on the individual too, sometimes group discussions can be helpful if other people are modeling these positive behaviors. And then I've also found it helpful when trying to teach a skill is to show like a short video of someone actually playing out what you were just talking about. So they don't only hear it, but they can see it in action. And that's kind of best practices. It may work, it may not work, but you really have to individualize your approach to that person.
Thank you. Besides vocational rehabilitation and career services on campus, what other resources can help the college student with autism when it comes to increasing the likelihood of their finding gainful postgraduate work?
I think anything you can do to teach, model, and coach pro-social behaviors, appropriate body language, the use of appropriate facial cues, how to dress effectively for an interview, how to not over ask too many questions. These are things that are talked about. So sometimes connecting the person with an autism informed job coach might be very, very helpful, and helping that student, if appropriate, getting connected to an employer who is an autism friendly employer is one of the best bets you can do. And you can teach these skills face to face, you can teach them online, but just be aware when you're working with folks with autism, teaching a skill one time sometimes might not be the most effective way. Sometimes it's got to be repetition. Sometimes maybe you're teaching the skill in your office, but then you have to teach it actually in the environment as well, because some students with autism have a hard time taking what they've learned in one setting and apply it to a different setting. So repetition, consistency, structure, role playing, and maybe even looking into some of that Lego therapy I mentioned. That might be an interesting way to teach some job skills too, to incorporate that. There's a lot of things you can do around that. Shoot me an email. I'll give you a ton of other ideas.
Perfect. Thank
Perfect.
you.
Yeah, you're welcome.
How do you adequately accommodate needs of autistic students in a class discussion without compromising the needs of other students?
That's a tricky balance. What I would recommend is obviously talking to your supervisor, administration, maybe doing some consultation with an autism expert, really figuring out policies, procedures, practices, making sure you're falling in line with your ethics and all of those things. And then I think where this comes into play, some routine trainings for your entire faculty, your student body on autism could really go a long way. I really think more education around this topic in college campuses could really help other students better understand, maybe have more empathy. Maybe it can create more patience. It could reduce some bullying and teasing in some of these settings as well. These are all things talked about in the best practices literature as well. But a lot of times too, it's not clear cut. Sometimes you really have to have a team approach as well. So consultation, working with people who understand these topics and really individualizing your approach in that classroom might be very effective and helpful.
Thank you. On the flip side, what is the best way to deal with a student on the spectrum who ends up terrorizing the students and professor each class period?
It is very, very tricky, and it has come up in some situations that I've consulted on. And in some cases, that student may not be appropriate for that classroom. If there's threats going on, if there's harassment, it is important to talk to your administration, making sure that safety of other students is taken into account as well. Having some meetings with that student can be very helpful. If appropriate, getting releases of information signed. Maybe the student has a guardian. Maybe the student has some caregivers you can involve in the process. Obviously, you'd want to ensure confidentiality. In some cases, the student might need to be referred to more psychological kinds of treatment where they're dealing with some co-occurring issues that are well beyond the competencies of that college professor. So it's very important to take into account safety of the other students as well, and involving other professionals and really sometimes forming a multidisciplinary team. That's talked about in this research too, where we can't do it alone. We need to form partnerships with other providers, other professionals, because some of these individuals do present with a number of challenges as well that can be very tricky to work with in a classroom.
Thank you. Um, and then there's a clarifying question. Do roughly 80 to 90% of all Gen Z students fall somewhere on the autism spectrum?
No, no,
Okay.
no. The statistics right now in the general population is about 1 in 44. So you will be seeing increased numbers of college students with autism, but it's nowhere near that number. Autism is the fastest growing neurodevelopmental disorder in the United States. ADHD is the number one diagnosed neurodevelopmental disorder, but autism is the fastest growing. So you're going to see more and more students on the autism spectrum, or a lot of students too who have true autism may be misdiagnosed with another disorder or have never been diagnosed at all. So take that into account as well. Not everyone on the autism spectrum has been identified as having autism in the past as well. So you may be working with a lot of students that present as having autism or some symptoms of autism, but they've never been officially diagnosed.
Thank you. Do
You're
you have
welcome.
any closing remarks for us?
Yeah, I really appreciate all of you taking time out of your day. Please reach out. This is a lot of information we covered. I have some good handouts, some good links to podcasts, some articles I've published on a lot of these topics. And I encourage you to take your knowledge to that next level and continue to learn about this topic, because there's a high likelihood, again, if you're working in academia, you're probably going to see more and more students over the next many years on the spectrum. So if we can become more informed, we're only going to be in a much better position to help enhance academic performance and outcomes for students on this spectrum. So thank you again, everyone. Great questions. And I hope you have a lovely rest of your week and weekend.
Thank you so much. Thank you, Professor Brown, and thank you all for attending today. We will be emailing you a link to view the recording of this webinar once it's available. If you or any of your fellow instructors are interested in presenting for our Learning and Growing webinar series, please submit your proposals to the Learning and Growing website, which I'm going to go ahead and link in the chat now for easy access. These free webinars are brought to you by Hawks Learning, an innovative educational courseware company. To learn more about our mastery-based course materials and how Hawks can enhance learning outcomes for you and your students, please visit hawkslearning.com. And I hope everyone has a great rest of your day. Thank you all for attending.